Well, the first question I'm going to start with, and I'm going to ask Dr. Khalil to tell us a little bit about what the latest technology and what's the latest trend in cancer care, and how do we take care of that here at St. Bernard's. Dr. Khalil.
Well, the latest care in cancer care is coordination. When someone diagnosed with cancer, it's not about making diagnosis or giving treatment. It's about taking care of the patient as a whole. From the time the test is done, to the time the diagnosis is made, to the time the treatment is given, to emotional support, financial support, to the follow-up after treatment, supporting the patients and the family too. So coordinating and navigation is the best thing we've had in the last few years in the United States, and we're doing really well here in St. Bernard. We started our navigation program a few years ago, and we're way ahead of the curve. So coordinating the care by having navigators. I have Jana and Angie here. They're our patients navigators, help coordinate the care. To me, it's the biggest improvement in cancer care. And the second is the new treatment options. Every year we have new treatments that target cancer that actually has shown to be better in outcome in treating the cancer and has less side effect on complication for patients. And overall, the result is very promising. We have a new chemotherapy treatments approved every few months. We have several types of new immune therapy that we use currently to treat cancer. We have what I call it the smart drug that actually could target cancer without any significant side effect, but at the same time give us great results. That's what I see from my side, and there is other improvement in technology in terms of what imaging we can do, how we can evaluate response to treatment, and there is new techniques and testing allow us to diagnose even cancer early. And I'll let Dr. Allgood explain to you more about what the new in technology in treating cancer from radiation oncology view.
From our perspective, we're very technology driven, and one of the new programs we've been working on is something called Stereotactic radiation therapy. Imaging is very important to us, and we're getting more and more digital imaging and being able to use that imaging very well to focus on tumors. And when we can focus on them, again, we try to minimize side effects and try to increase the cure rates of patients that we treat with cancer. And so stereotactic radiation therapy would be a treatment where we'd be very focused on the tumor, trying to minimize damage to normal tissue. And we've been working on that probably for a year, and we're going to treat our first patient here within the next month or so.
That's really exciting to be able to have this specific type of radiation given right in here. So if somebody has a small tumor, instead of having to give radiation to a large area, now the radiation is going to be focused precisely on the tumor itself without causing damage to the tissue around the tumor. So this would give us a better result and less side effects, and that's really exciting.
Yes.
And I think we're glad that we have this. Maybe Jana can explain to us about what she does as a navigator.
As the Cancer Care Navigator, we look at the whole family as the patient. We don't only treat the patient, we look at the family also. We provide support, emotional support to the patients. We help link them to the resources that are in the community. We also we're an advocate between the patient and the doctor, because a lot of times the patients don't feel like they can ask questions or they think they may be stupid. So we're able to say, please ask the doctors, make your list, have your list ready for the doctors when they come in. We are a support system where we contact the patients, and we're there through the whole diagnosis, from diagnosis treatment on.